Okay. Hi, good morning. So morning to everyone and also to our live listener today. I'm Dr. Lau Ka-Fu, the consultant physician and neurologist is in Hospital Pantai. So today I'll be sharing to you all a bit about my knowledge on stroke and what is stroke. So, okay, so today this is my outline of my presentation. I'll be talking about definition of strokes. What are the types of strokes? What are the risk factors for strokes? What are the symptoms of stroke? What do we do for patients with stroke? And what about stroke recovery? Okay, so moving forward, the definition of stroke. Stroke is defined as rapidly developing clinical sign of focal or global disturbance of cerebral functions with symptoms. So the symptoms should be lasting 24 hours or longer or leading to death with no apparent cause other than that of a vascular origin. So a stroke or a brain attack occurs when the blood circulation to the brain fails. So the brain cells can die from the decreased blood flow and also resulting from lack of oxygen. So we have a lot of patients that come in with focal neurological deficit, basically means that they can't move one hand, they can't move one leg, or they have slurred speech. But if the symptoms is due to a brain cancer or brain infection or even immune system problem, we don't call them a stroke. So we can only say the patient have a stroke if the neurological problem is due to vascular in origin. Basically means that it's due to the blood vessel. So oxygen supply to the brain is affected because of vessel problem, then we can say these patients have stroke. So what are the types of strokes? There are two types of stroke. The first type is actually ischemic stroke, and ischemic stroke is actually caused by narrowing of blood vessels, leading to the reduction in oxygen to the brain cells. So the most common cause for ischemic stroke are due to atherosclerosis, causing the narrowing or occlusion of the cerebral blood vessels, or can be due to a blood clot from the heart. While the second type of stroke is actually the hemorrhagic stroke, or known as bleeding stroke. Hemorrhagic stroke is caused by a rupture of blood vessels, leading to reduction in oxygen supply to the brain cells. So this bleeding can be caused by poorly controlled hypertension or due to blood vessel abnormalities such as aneurysm. So patients with atriovenous malformations can have bleeding. Those patients with long-standing hypertension, suddenly the high blood pressure spike up can cause them to have this hemorrhagic stroke. So this is a diagram to explain how ischemic stroke happen. As you can see from this image, the blood clot, whether it's actually from the heart or it's actually from the atherosclerotic plaque, the blood clot will travel in the brain to the smaller blood vessel and occluding it, leading to a stroke. While in patients with long-standing hypertension, like I said just now, there is this intimal changes or the changes of blood vessels wall. So these blood vessels wall changes causing the wall to be weakened and subsequently rupture because of high blood pressure. And this causes hemorrhagic stroke. The third type of stroke, or everyone calls it a minor stroke, which is actually a transient ischemic attack. So transient ischemic attack is a transient episode of neurological dysfunction caused by focal brain ischemia without acute infarction and lasting less than 24 hours. So these patients, TIA or minor stroke patient, usually had a transient neurological problem such as weakness, slurred speech, facial asymmetry that recovers within 24 hours. This is a type of ischemic stroke where the blood clot causes transient blockage of blood flow to the brain, which resolve before the brain cells dies. The symptoms can be very subtle, like mentioned just now, mild facial asymmetry, speech problem, unilateral numbness or weakness that resolve quickly. Unfortunately, most patients ignore the symptoms or they think nothing is wrong with her, but this minor stroke can progress and become very severe stroke. This is a scoring system that we use for patients with minor stroke to evaluate and calculate their risk of recurrent and progression stroke. As you can see, what I circle here, the chances of progression of stroke or actually another stroke attack goes up to 30% by 3 months if the symptoms of this minor stroke is untreated or they didn't really seek treatment. So it's actually very, very important for anyone with any focal neurological deficit to see medical doctors as soon as possible so that we can treat early and reduce the risk of stroke progression or another stroke attack. So what are the risk factors for stroke? Unfortunately, anyone actually has risk of having a stroke, but just that, what are the chances or what are the percentage of you having a stroke within 10 years? So patients with these risk factors are more predisposed to stroke, which is hypertension, patient with diabetes mellitus, patient with cholesterol problem, patient who is actively smoking, patient with heart problem, and patient who consume a lot of alcohols, and also family history of stroke, those patients with family inheritance. The reason behind the stroke pathogenesis in these patients are actually quite similar because of formation of atherosclerosis or narrowing of the blood vessel changes that lead to narrowing of the blood vessels. So both parents with history of stroke may cause the children to have slight increase of stroke, but that is actually mediated through genetic and also shared environmental factor, which is our daily activity, whether we are exercising or food intake, that actually increases the risk of stroke. But those patients with strong family history, those patients with very much inherited stroke or young stroke patient may have disease such as Cardiac fibris or even mitochondrial diseases that can actually be inherited. So as we know, diabetes, hypertension, and high cholesterol level were actually rising among Malaysians. So what are the risks for patients to have a stroke? So this is actually a Framingham risk score that you can see is actually from 1991. So there are a few points: age, blood pressure, diabetes, smoking, heart problem, heart irregularity, or even the heart left ventricular hypertrophy, as in the heart is slightly bigger. So as you can see here, age is something that we can't change. We age every year, but we can actually treat the blood pressure. We can control the diabetes, stop smoking, and also treat the underlying heart disease. So as you can see, the more points from here, the higher the blood pressure you have, the higher score you have. Diabetes, cigarette smoking add to the risk as from here, the points will be higher. So these cumulative points actually adds to the 10-year probability of patient developing stroke. So if your points are high, let's say you're 30%, so within 10 years, your probability of having a stroke is actually up to 87.9%. Okay, so coming to next question, what are the symptoms of stroke? Stroke patients have sudden or rapid onset focal neurological symptoms. So in another word, patients with stroke were very well prior to the attack, then suddenly developed this neurological problem. Symptoms and signs of stroke actually depends on the type, location, and extent of the affected brain tissue. So to make things easier, this mnemonic is actually very useful for anyone to recognize patient with stroke. FAST. F stands for face, with either facial weakness or even facial numbness, or one side of the face is drooping. A for arm, unilateral arm weakness or numbness. S for speech difficulty, whether it's actually slurred speech or not able to talk. And T is time for you to call ambulance immediately or seek medical treatment immediately. So this mnemonic actually simplified for everyone. So, and also for you all to assess patient with symptoms or focal neurological problem to see whether or not patient actually has a stroke. So I've actually attached a video from Heart and Stroke Foundation in Canada, and this video shows a classic presentation of someone with stroke. So this video actually shows a patient who is very healthy gentleman in the middle of the dinner conversation with his wife and daughter, and stroke happened during that time. Let's just view the video and see.
Now he's been wanting to put garlic chives in everything.
Well, not everything.
Dad, the side of your face is drooping. Mom?
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I just
Honey?
Oh, Dad!
Tim!
I need an ambulance to 7th floor
Tim!
Avenue.
Tim, look at
I
me,
don't know what
Gracie.
the-
Tell them to hurry.
I
Tim,
don't
look at
know.
me. Look at
Mom,
me,
what
Tim.
is- Mom, what are we talking
I don't know. I think he's having a stroke.
I think my dad is having a stroke.
Tim, what's going on, baby? Yes, but he.
Okay, as you can see from the very starting of presentation of this video, the husband is actually someone who is very, very healthy, chit-chatting with the wife, and suddenly out of a, see, he's still playing with his iPad, able to chit-chat with the wife, talking normally, and then suddenly, let me scroll the video again, sorry.
Now he's been.
And then at this moment here, you can notice that the husband's face is actually deviated on the right side. There is actually a right-sided facial droopy. And when they ask to lift up the hand, you can see that the right upper limb is not able to move. So from here, F, there is facial deviation. A, the arm is not able to move. And when he asks him to speak, the speech is actually very slurred. So FAS is positive, and then subsequently they call the ambulance.
Tim.
Need an ambulance to 7th floor.
Now he.
Okay, so going slightly deeper, there are actually patients with stroke involving their little brain. So this kind of patient might not present with unilateral facial weakness or arm weakness, but complain of having balance problem and eye problem. So the next one will be B fast, where B stands for balance, where patient actually has loss of balance, coordination, or dizziness, and E is for blurring of vision or loss of vision. This kind of patient often present late to the hospital, and they usually, some of them see ENT for vertigo, some of them see ophthalmologist for vision problem, and then only was referred to the neurologist for stroke. So these are some example of patient that experience, stroke with the little brain rather than the classic limb weakness. As you can see, the first image here, the left eye appears smaller than the right eye, and also the pupil size is actually smaller on the left side. This patient actually has a left eye Horner syndrome secondary to stroke. And this is what we call as left eye hemianopia. As you can see that the vision on the eye is actually half of it is gone due to a stroke. And this is the other one, that patient is actually very clumsy balancing problem. So this is what I meant by B, balancing problem, E, hemianopia, eye problem. Okay, so what can you do while waiting for the ambulance? So number one, do not panic. And note the time you first see the symptoms. This is actually important for the subsequent talk that I will brief you all. What's the reason why time is important? Do not let that person go to sleep or talk you out of calling 911. Do not give them medication, food, or drinks. Do not drive yourself or someone else to the emergency room. Try to call an ambulance and keep the patient out of danger and also in recovery position while waiting for ambulance. So this is what I meant by putting the patient into the recovery position. Is you can lie the patient on his left side or on his right side, keeping on hand keeping one of the hand under the chin to keep the mouth open and slightly elevated, and the other arm and leg will bend to support the patient position. So this is what I meant by recovery position. So this is what you can do for patients with stroke while waiting for the ambulance to arrive. And what do we do for patients with stroke? In Pantai Hospital, Ipoh, we actually have both CT scan and MRI scan readily available for patients with stroke. Acute stroke patients that came to casualty were given priority for scans, as time loss equals to neuron loss. So we do have on-call neurologists and neurosurgeons to treat acute and also chronic stroke in Pantai Hospital 24/7. I've included two images of patients with stroke. As you can see from this CT scan, there is actually a large hypodense area on the right side. This is actually the hypodense means that the image appears slightly darker, as evident from the arrow here. And this represents ischemic stroke that is actually caused by narrowing of the blood vessels to the brain, leading to reduction in oxygen to the brain cells. On the second image, you can see that there is actually this large hyperdense area, which appears brighter on the right cerebral hemisphere. And this represents hemorrhagic stroke that is caused by rupture of blood vessels. So there is actually a very big two contrasts in this. One is hypodense, the other one is hyperdense image. So in patients with ischemic stroke will also be evaluated further for their risk of stroke or causes for their stroke by scanning their carotid and cerebral vessels. So this is one of the images that we can see that the vessels to the brain remains very much patent, and there is actually the blood vessels patent with good flow to even the distal parts of the brain. While on second image, you can see here that there is actually occlusion of the left, one of the major artery to the left brain, and this usually causes a very large hemispheric infarct. So apart from CT and MRI, heart assessments are also important for certain patients with stroke to look for irregular heart rhythm or blood clot formation in the heart chambers. This is an example of echocardiography, basically an ultrasound of the heart to look for any structural problem, heart function or blood clot, because the treatment differs for this kind of patient. So apart from imaging, we will also be sending off a lot of blood tests for our patients to identify other stroke risk and also to treat accordingly. So moving forward, continue, what do we do? How do we treat patients with stroke? So we actually emphasize on the phrase time is brain as treatment for patients with stroke. For every minute delay in treatment, we lost about 1.9 million brain cells. So the earlier the patient is brought to the hospital, the more brain cells we can salvage. The golden time frame for stroke treatment, acute ischemic stroke treatment, is 4.5 hours, where we can administer this strong clot buster medication to restore blood circulation to the brain to reverse or reduce the area of ischemia. So that is why it is important for eyewitness to note the time of stroke incident clearly, because if we administer the medication more than 4.5 hours from the onset, the risk of bleeding is slightly higher. Unfortunately, this medication is not for all patients with stroke. If the stroke is too large, we can't give. If the if the stroke onset is more than 4.5 hours, the risk of bleeding is slightly higher and we can't give. If the patient is on any very strong blood thinning medication prior to the stroke, we can't administer this medication also. So for patients that present later than 4.5 hours, or those that I mentioned just now, which is contraindicated for this thrombolysis treatment, we have other blood thinning medication to be given for patient to prevent the stroke from progressing further and to prevent another stroke event. And even by hospitalization, intravenous drip itself can improve the perfusion to the brain so that the risk of stroke progression is reduced. What about bleeding stroke? In patients who have hemorrhagic stroke, of course, we can't give them blood thinning medication. The management depends on the etiology, the reason for the stroke, and also the size of bleeding. So our neurosurgeon consultant will decide the need for surgical intervention depends on the imaging finding. But if the patient's blood pressure is very high, we should control the blood pressure up to a certain level. If the patient's conscious level is not good, the bleeding is too big, then surgical option is definitely indicated. So save someone else by using a needle. This is a huge myth that I would like to highlight during this talk, because some individuals believe that releasing blood from the fingertips with needles are useful for acute stroke. This first aid therapy of bloodletting puncture of hand for stroke comes from the blood book of this great compendium of acupuncture back in 1522 and 1620. So the reason behind this is actually very simple, is to increase the blood pressure and to improve the patient consciousness. But mind you, this study was only done in 30 patients back in 500 years ago, and it's actually done in a very, very strict environment. And more importantly, this study was not recommended, not even mentioned as first aid therapy for patients with stroke victim at home. So this myth or this practice is actually not useful for anyone with stroke. And when the patients come to us with all these puncture marks, we administer clot buster medication. The problem is they might actually bleed more. That is the first problem. And after that, if the patient is in pain, the blood pressure will be shooting up, and the risk of bleeding will also be higher in the brain. So please don't do this at home. If there is any problem with stroke, please come to hospital. So now next we talk about the last chapter of today about stroke recovery. Stroke treatment actually extends beyond acute stroke treatment and also further stroke prevention that I mentioned just now. Stroke rehabilitation plays a major role to help stroke patients back to normal or achieve better functional independence. And stroke rehabilitation starts as soon as the patient is stable in the ward. Stroke rehabilitation has been proven to improve patients' functional status post-stroke. And robots actually do not replace the therapist, but this robot use can actually provide the therapist with a tool that allow the therapist to use his skills and also the knowledge. So in this robot-assisted therapy, it's actually the therapist's responsibility to operate on the device and to help them for rehabilitation. So there is no definite end to recovery, but most rapid improvement is actually seen within the first 6 months of stroke. So we have multiple different treatment modalities that have been used for acute stroke and to aid stroke recovery. Although the clinical evidence were limited, they can be considered in the treatment for acute stroke. So these are the treatment options that are available in Malaysia, but like I mentioned, the clinical evidence were very limited. Neuro8, citicoline, cerebral lysine, edawan, ginkgo, vitamin B folate, SSRI, acupuncture, TMS, and also piracetam. Although these medications were given on top, all these medications were given on top of rehabilitation and physiotherapy during some of the small clinical trial, and there are actually small improvement in patients with stroke recovery. But mind you again, and I emphasize, this is given on top of rehabilitation and physiotherapy. So this actually highlight the importance of rehabilitation in patients with stroke recovery. So just a small note about acupuncture, because I got asked most of these often, and there is actually no compelling evidence to show that acupuncture is effective in stroke rehabilitation. With stroke rehabilitation, acupuncture has no additional benefit on motor recovery, but there is actually a small positive effect on disability, which may be due to true placebo effect or varied study quality. However, without stroke rehabilitation, the efficacy of acupuncture is actually remain uncertain. So mainly because of the poor quality of the study. So if you ask me, if you have to choose one, choose rehab. If you can do both, there is no harm in doing acupuncture and rehabilitation at the same time. Okay, so this is actually my last slide. I will leave you all with this mnemonic fast. So for you all to identify patients with acute stroke and to send to hospital immediately for stroke treatment. F for face, one side of the face is drooping. A for arm or leg weakness or numbness. S for speech difficulties, and T for time for you to call ambulance immediately. Okay, thank you. So there is actually this question in Facebook Live who asks, why can't some patient identify stroke symptoms? Like I mentioned just now, if someone has a very major stroke, there is no question about it. When they can't lift up one hand, they can't speak, definitely this patient has a stroke. But at times the stroke is too minor, or at times the stroke doesn't affect the motor fibers. So like I mentioned, there are actually patients that come with eye problem, where side of this eye, where they can't see the eye, my hand over this side, but their vision in front is actually very, very normal. So this kind of patient, they don't realize that because we don't use our sight vision or so-called temporal vision that much. So this kind of patient actually tends to miss this finding until eventually one day they were trying to park their car, then they bang into the wall, or when they try to walk through a door, they bang into this door, then they will realize, oh, maybe my vision, there is some problem. I actually have patients that have this stroke, where they have this vision problem for more than 2 weeks, and then only they realize they actually have problem on the left side, the left temporal vision here, because he keep on driving in the center of the lane and also sometimes hitting on the left side of the car. So that is the reason why they come to us. Otherwise, if someone actually has a very major stroke, like one hand cannot move, suddenly cannot talk, usually they will miss. It's actually, most of the time, some of this small little area of stroke that people tends to come in late to the hospital. Okay, so with that, I'll thank you all so much. Okay, thank you for listening. Hope you all learned something about strokes today.